Good morning. In this video, I'm going to talk about the recurrent urinary tract infection. Why do they keep coming back and how to manage them? So, do you keep getting urinary tract infection even after taking antibiotic? You are not alone. Recurrent UTI affect millions, especially women, and they can be painful, frustrating, and disruptive. But why do they keep coming back? And that's the question. And what can you do beyond just antibiotics? So let's break it down step by step. So what is recurrent UTI? A UTI is infection in the urinary system, bladder, urethra, and kidneys. Recurrent UTI means two or more infections in 6 months or three plus infections in a year. It's common in women due to shorter urethra, but men can also get them, especially those with the prostate issues. What are the common causes and risk factors? Anatomy: shorter urethra in women, sexual activity, so-called honeymoon cystitis, menopause, loss of estrogen leads to weaker bladder lining and more prone to having bladder infection. Poor hydration. Concentrated urine is a perfect culture media for bacteria to thrive. Constipation, pressure on bladder, incomplete emptying. Diabetes, high sugar in urine feeds bacteria. Catheter or kidney stones, resistant bacteria due to repeated antibiotics usage. How it presents: burning while urinating, increased frequency and urgency, cloudy, foul smelling urine, pelvic pain or discomfort, fever, chills if kidney infection develops. Some women confuse interstitial cystitis or pelvic pain syndrome with UTIs, and that needs different approach. Diagnosis: urine analysis and urine culture is a gold standard. Culture helps identify bacteria so that your doctor can prescribe you appropriate antibiotic. Sometimes imaging may be needed. If infection is severe, unusual, imaging of your bladder, kidney, and ureter. Don't just keep taking antibiotic without culture because there's a high risk of resistance. How do you manage? Well, stay well hydrated, number one. It dilutes urine and flushes bacteria. Urinate after sexual activity. Avoid spermicides or harsh soap. Wipe front and back. Cranberry extract, d-mannose, and probiotics, they are helpful. Vaginal estrogen cream in postmenopausal women to protect bladder lining. Medical approaches: short course of targeted antibiotics guarded by culture. In severe cases, low dose of prophylactic antibiotic can be given for months. But the underlying cause must be treated. If there's a enlarged prostate, that needs to be treated. If there's a poor diabetes control, that needs to be managed. If there's a kidney stone, that needs to be managed as well. So recurrent UTI are not just random bad luck. They usually happen because of underlying risk factors that need to be addressed. And the good news is that with the right combination of lifestyle, preventive measures, and when necessary medical therapy, you can reduce the frequency and protect your bladder health. If you or loved ones are struggling with recurrent infection, don't just rely on repeated antibiotics. Talk to your doctor about deeper evaluation, prevention strategy. You may have to see a urologist in some cases. So thank you for watching. Happy Friday.